Hello, everybody. This is Gary. Today is December 2nd, 2022. It is 11:51 a.m. Eastern Standard Time in the United States in Rochester, New York, and it's Friday. Um, this is my Coping with Schizophrenia blog entry for today. Today I'm doing better than I was yesterday. My paranoia is not that bad. My delusions are not that strong. My auditory hallucinations are at a bare minimum. My anxiety levels are pretty low, and my depression is not that severe. I have a psychotherapy appointment coming up next Wednesday. I have a psychiatrist appointment on the 8th, which I believe is Thursday of next week. And on Monday, I have a telephone interview with my gastroenterologist. Um, I will be talking to my therapist about the past 2 weeks being pretty rough with my paranoia and delusions and my auditory hallucinations, as well as high anxiety, insomnia, depression. Um, I actually got some pretty good sleep last night. I woke up at 5 a.m., took a shower, brushed my teeth, shaved, got dressed, and then went back to sleep. And so I got a good amount of sleep, even though I woke up at 5 a.m. fairly early. I took my mornings around 5 a.m. this morning, and I also took some Klonopin and did some meditation and fell asleep. I just took some Klonopin a little while ago and did some meditation. I still have to do my daily walk and physical therapy exercises. My physical pain is not that severe. I take several medications for physical pain, including Tylenol, Motrin, Cymbalta, Flexeril, and Neurontin for pain. Um, I don't have an appointment with my primary care for another 5 months. There's nothing medical that's urgently happening, at least not something to see my general practitioner about. I do have to talk to my gastroenterologist about difficulty in swallowing. I keep getting food lodged in the lower part of my esophagus, so where it's not blocking my airway, but the food is getting stuck there, and it takes 15 or 20 minutes for it to either come out through my mouth or go down into my stomach. Depends on also on how well I chew my food, but they may have to do another endoscopy and put a camera down my throat and dilate my esophagus. They have to do this every once in a while because my Seroquel, which I take as an antipsychotic and mood stabilizer, has a tendency to interfere with the smooth muscles of the esophagus and prevent me from swallowing food correctly. I would like to get this corrected if at all possible. Um, I've had it done before. Um, my psychiatric symptoms are not that bad today. My anxiety levels are pretty low. The meditation and Klonopin always help. My auditory hallucinations are not that bad. When they do get bad, I do have Zyprexa to take to reduce the psychotic symptoms that I'm having. Um, my motivation is better today than it was over the past few days. When I have a lack of sleep, that makes everything else more difficult. When I sleep better, that makes everything a lot easier. That's true for anybody, whether they have a mental illness or not. A good night's sleep is important, and the best way I've been dealing with all my psychiatric symptoms is sticking to my daily schedule. I just did some work on my computer. I do consumer surveys for extra money. Um, I haven't had a cigarette in 12 months. I'm still addicted to nicotine. I have a nicotine lozenge in my mouth right now. I use 10 to 15 lozenges per day, which is very expensive. These things are not cheap, um, but they're safer than smoking cigarettes, and I'm not ready yet to give up on quitting nicotine. I think I'll be using the lozenges for quite some time. I've already been using them for over a year, but I haven't had a cigarette in 12 months, and that's safer not to smoke um, and use nicotine lozenges. Um, my overall psychiatric symptoms are not that bad today. I think I'm coping all right. It's getting colder outside. Hasn't snowed yet, surprisingly. Buffalo, New York, which is about an hour away, driving time, got hit with a really bad snowstorm. But we haven't gotten anything here in Rochester, New York yet, as far as a snowstorm goes. And the weather, colder weather, always makes my physical pain more severe. The arthritis in my lower back, the arthritis in my upper back, the pain in my right knee, where I had surgery to remove a torn meniscus. That pain gets a little bit worse during the winter, and my leg feels a little bit more stiff. Um, and the psychiatric symptoms tend to get worse during the winter for me and for a lot of other people. Um, so I'm just coping the best way I can. Like, comment, share, subscribe.